Welcome to the Coral Study. I'm Dr. Barbara Warnes, a trial manager at the Bristol Trial Centre at the University of Bristol. In this presentation, I'm going to give you an overview of the Coral Study. It will cover the background and design of the study, the research question you want to answer, and GP practice involvement. This video is for the principal investigators at the GP sites, clinicians and site staff who will be helping with the eligibility searches, as well as anyone who will be interacting face-to-face with participants, such as research nurses, clinical pharmacists, or research practitioners. Thank you for listening. Before we start, I'm going to remind you of the importance of good clinical practice, or GCP. GCP is an important ethical and scientific quality standard for the design, conduct, performance, monitoring, auditing, recording, analysis, and reporting of clinical trials. GCP states that the right, safety, and well-being of the trial subjects are the most important considerations and should prevail over interests of science and society, and that all clinical trial information should be recorded, handled, and stored in a way that allows its accurate reporting, interpretation, and verification. Listening to this presentation, so you're trained to perform your role in the Coral study, is one of the ways of ensuring that you are compliant with GCP. Anytime you see this green key, it means we are noting a key aspect of GCP that is relevant for the Coral study. The Coral study is being conducted to support the licensing of a medicinal product and, as such, must be conducted in accordance with the Medicines for Human Use Clinical Trials Regulation and is subject to oversight and inspection by the MHRA. Heart failure is a long-term condition that affects almost 1 million people in the UK. Symptoms can significantly impair quality of life for heart failure patients and include breathlessness, fatigue, and leg swelling. The investigational drug we are testing in the Coral study is called coenzyme Q10, or CoQ10. CoQ10 is a nutrient naturally found in nuts, meat, and fish. It can be bought as a health supplement in health food shops or pharmacies. Previous research suggests a potential benefit of CoQ10 in heart failure patients on all-cause mortality and hospital admissions. However, more research is needed when looking at whether it can improve quality of life and the symptoms of heart failure. The IMP and placebo for Coral are being produced by Pharma Nord. We've been funded by the NIHR HTA to answer the research question. In patients with heart failure with reduced ejection fraction, is the addition of CoQ10 to usual care clinically and cost-effective? We have two main objectives. Firstly, to determine whether CoQ10 improves symptoms and quality of life in people with heart failure, and secondly, to determine whether CoQ10 is cost-effective. Coral is a pragmatic randomized controlled trial, or RCT, with a cost-effectiveness analysis. The study opened to recruitment in February 2025. Overall, we will recruit 950 participants across England to take part in the study. The primary outcome of Coral is participant-reported heart failure-specific health-related quality of life assessed using the Kansas City Cardiomyopathy Questionnaire, or KCCQ, 12 months after randomization. These data will also be collected at 4 other time points, baseline, 3, 6, and 9 months after randomization. We have a number of secondary outcomes, including all-cause death, all-cause hospitalization, major adverse cardiovascular events, and resource and health service use. The secondary outcomes will be collected via participant-completed questionnaires, medical records, and NHS England. In the Coral study, participants are asked to take one capsule 3 times a day with food for 12 months. The capsules will either contain 100 milligrams of CoQ10 or they will be a matched placebo. They'll be sent directly from pharmacy to you to the participant's home. Participants will then complete 5 questionnaires, first at baseline, then 3, 6, 9, and 12 months after randomization. The questionnaires will ask about their symptoms, quality of life, whether they've used the NHS or had any help or care. Each questionnaire will take 20 to 30 minutes to complete, and participants will be offered a £10 gift voucher per completed questionnaire. The Coral BTC team will coordinate the questionnaire completion. We hope that most participants will complete the questionnaires on paper or online, but we have included provision for face-to-face appointments by the RDN Agile or Direct Delivery team or GP staff if this can be accommodated at your site. The first 190 participants recruited into the study were asked to take part in a medication counting exercise. We asked these participants to send back any capsule that they haven't taken to the Bristol Trial Centre so that we can objectively measure adherence. This work has now been completed. The inclusion criteria for the study are as follows. Participants must be over 18 years old, with evidence in their GP record of heart failure and left ventricular systolic dysfunction, or LVSD. Evidence of LVSD will be in QOF codes or in letters or notes in GP records. Participants must also indicate that their heart failure has an impact on their daily life by scoring class 2, 3 or 4 on the New York Health Association score, or NYHA. The NYHA is a scale for assessing symptoms of heart failure. Their score will be confirmed by the participant during the screening process with the Coral BTC team. The exclusion criteria for Coral are as follows. Systolic dysfunction with no evidence of left ventricular systolic dysfunction. Supplementary CoQ10 intake within the last 6 weeks. We will check this at screening, but to highlight here that some health supplements or multivitamins contain CoQ10, but is not listed on the main label. Also of note is that CoQ10 goes by a few names and might be listed as ubiquinone or ubiquinol. Other exclusion criteria are current warfarin use, as CoQ10 may reduce anticoagulant effect of warfarin, a known allergy to soy or peanuts, currently enrolled in another interventional clinical trial. Participants must be able to give informed consent to take part in Coral. Importantly, we are trying to be as inclusive as possible. We will ask you to confirm whether the participant has capacity or not, but we ask that you do not exclude potential participants because of reasons such as language barriers, as we are translating documents and have provisions to use a translator service, or exclude them because of mild cognitive impairment, as our primary outcome measure, the KCCQ, has been validated in patients with mild cognitive impairment. Participants will also not be able to take part due to diet choices, as the capsules contain halal bovine gelatin. And for women only, if they are pregnant or breastfeeding, they will not be able to take part. Women under 55 or premenopausal will be asked to complete a pregnancy test before giving their informed consent. Please note that some of the exclusion criteria will be assessed by the GP and checked by the participant at screening, and some will only be asked at screening. This is indicated with the blue and green circles. This slide shows the first part of the Coral recruitment pathway. First, an initial database search will be conducted to produce a report of the anonymous demographic data for your patients with coding for heart failure. The next 2 steps are optional and can be skipped if your site team have limited capacity. In step 2, a search will be run to identify the patients with heart failure who do not have LVSD coded. Staff should then add the LVSD QOF codes to the relevant records, where there is evidence of it in the medical notes. In step 3, a further database search is then conducted, which will produce a report of the anonymous demographic data for the patients with new coding for heart failure and includes those with a newly coded LVSD. In step 4, a search will be run to identify people over 18 with heart failure and coded LVSD, and excludes people taking warfarin, those with a soy or peanut allergy, or those with a coded lack of capacity. The people found in this search will proceed to eligibility screening, where all the eligibility criteria need to be manually checked. This step must be completed by a GP. There is more information on this in the database searches training video and EMIS System 1 instructions. Next, an invitation text should be sent to all those eligible participants who accept text messages. We will provide the appropriate text for this message. In step 6, the final list of eligible participants will be uploaded to DocMail, who will send out the invitation packs in the post. These packs contain an invitation letter on headed paper, a brief study summary, an expression of interest form, which can also be completed online, and a prepaid envelope. In the final step, At least 2 weeks afterwards, non-responders will be contacted by phone by staff from the GP practice to see if they're interested in taking part. The Coral BTC team will provide you with a list of non-responders. Help may be available from your local RDN team for this step. After we receive an expression of interest at the Bristol Trial Centre, the Coral team will call the participant to verbally check the relevant eligibility criteria with them. If a participant is eligible and happy to take part, they then give their informed consent. This can be done on paper or online and will mostly be by remote consent, so over the phone. However, if your site has capacity and you would like to offer this, participants can come into the practice to complete the consent process. This will only be offered if you agree to it. RDN Agile teams may also be able to assist with this. After giving informed consent, the participant completes the baseline questionnaire. We then ask a GP to confirm that the participant is still eligible according to their medical records. This step is to make sure nothing has changed, such as the participant hasn't started taking warfarin or is newly pregnant since the first eligibility check. To complete this step, you'll be sent an email with a link to click on that will take you to a form to complete. We cannot send participant identifiers in this email and will only supply you with the Coral Study ID. You will need to confirm the identity of your patient from the spreadsheet that you completed at the first eligibility check. A clinical member of the Coral Trial Management Group will then sign the e-prescription for the participant. The participant will be randomised to have either active CoQ10 or placebo, and the first batch of study capsules will be sent to the participant's home free of charge from pharmacy to you. Neither the Coral BTC team or the participant or you will know which capsules they have been allocated. This will only be known by staff at pharmacy to you for dispensing the capsules and the pharmacy at University Hospital, Bristol and Weston for emergency unblinding. There are some important things to note for the Coral study. Firstly, participants cannot take part if they are taking warfarin, as CoQ10 may reduce the anticoagulant effect. If participants are prescribed warfarin, please inform them to stop taking the study medication and to contact the Coral study team. If participants are taking antihypertensives, please ensure that the standard monitoring of blood pressure takes place and report changes of concern to the Coral study team. This is something we need to monitor in order to fulfill the safety requirements of the study. Participants who become pregnant will be asked to stop taking the study medication immediately and to contact the Coral study team. They will continue to be followed up until the end of the study. There are some other site tasks that you will need to complete. Please maintain and store your study delegation logs. It's an important principle of GCP that any staff conducting study activities are appropriately trained and qualified to do so. Delegation logs are a way of demonstrating this training, which is why they are so important. Any changes to the delegation log, including new members of staff or staff leaving, need to be signed and dated by the PI and emailed through to the Coral BTC team. You can add additional staff to the study after your site is opened. However, you will need to await confirmation from the study team before new members can undertake tasks. After a participant from your practice has joined the study, we will notify you with a recruitment letter and a copy of their consent form. We ask that you file this letter and the consent form in the medical records and complete the actions on the letter, which include adding an alert to the patient's general record regarding warfarin and the code for the study. We will also send you a number of email alerts at different points during the study. These will include when a prescription has been authorised, if there is a change in a person's participation status, for example if they decide to stop taking the medication or withdraw their consent, and if a safety event is reported. For each of these emails you must save a copy in the relevant medical records. We may need more information from you about a safety event, but we will let you know if this is the case. Pre-built database searches will also be provided to you to collect data from the medical records. Data collected will include long-term health conditions, prescribed medications, GP consultations and referrals. The Coral BTC team will contact you to let you know when and how to perform the searches. We're also asking you to report any safety events to us when the PI becomes aware of them. I will go over this in the next few slides. I will now go through the safety reporting processes for Coral. The Coral team may hear about a safety event first. This may be through follow-up questionnaires or if a participant contacts us directly to report an adverse event. If a Coral participant lets a member of the central Coral team know about a safety event, we will complete the appropriate form with as much information as possible. We may need to contact the participants to find out some more information from them. We will email you the form from our nhs.net email with instructions about the sections that we need you to complete. Please follow the instructions and return the form to us with an email from the PI confirming their assessment of relatedness. You are likely to be made aware of safety events when your patient presents at the surgery. We are also asking PIs to complete regular reviews of the patients who are taking part in Coral to check for any unreported safety events. We have suggested a monthly review. We expect each surgery to recruit around 15 participants and follow-up is for 12 months. These reviews may be supported by an administrator at your practice, as long as the PI is the one to assess the event. In the instance that you become aware of an untoward medical occurrence that represents a change in a clinical condition, the PI must first record the assessment of the event in the medical notes. The PI should determine whether it is serious and related to the Coral IMP. Second, they must decide how to report the event using the GP safety reporting requirements flowchart, which I will go through now. This is a copy of the GP safety reporting flowchart, which is also available in the study handbook. The flowchart and countdown start when the PI is made aware of an adverse event. The first step is for the PI to decide whether the event is serious, i.e. it meets any of the serious criteria listed here on the right. The next decision is whether the event is causally linked to the Coral study medication or the IMP. There are 5 categories for relatedness. If the PI or delegated clinician deems the event to be possibly, probably or definitely related to the IMP, this is an adverse reaction. Reporting requirements depend on the category of the event. I will go through how to report the events in the next few slides. If the event is deemed both serious and possibly, probably or definitely related to the IMP, this is a serious adverse reaction. These events must be reported to UHBW via email and the Coral study team using the UHBW Safety Initial Report form within 24 hours of the PI becoming aware of the event. If the event is deemed serious but unlikely or not related to the IMP, this is a serious adverse event, or SAE. SAE should be reported to the Coral study team via email using the GP SAE reporting form as soon as possible after you become aware of the event. Any adverse events that are not serious but are deemed to be possibly, probably or definitely related to the Coral IMP are adverse reactions. Adverse reactions should be reported to the Coral study team using the GP adverse event reporting form as soon as possible after you become aware of the event. Adverse events that are not serious and deemed unlikely to be related or not related to the Coral IMP do not need reporting to us. Please record the record of assessment of the event in the participant's medical records. We do not need to be told about them. Importantly, for all events, you should document in the medical records your record of assessment and the action that was taken. I will now show you what each form looks like. All forms are available on our website, and the password for the GP site section is coenzyme. Only GPs can establish the relatedness of adverse events. You must have selected Task 3 on your training log to be able to do this role. If you print, complete and scan the form and the PI or GP ink signs the form, you can email it to us from any account. If you complete a form electronically, it must be emailed to us from the GP or PI's professional email account. This email is our evidence that the GP or PI completed it and is needed for our audit trail. The form to report serious adverse events that are deemed to be possibly, probably or definitely related to the participant taking the Coral study capsules is shown here and is available on our website. Please note that the form may be updated periodically, so may not look exactly like the one shown on the screen, but the principles are the same. The most recent version will be available on our website. Events of these types should be reported to UHBW via email research@uhbw.nhs.uk and the Coral Study Team bnssg.coral@nhs.net within 24 hours of becoming aware of the event. Please then complete sections 5 to 9. Importantly, for section 7, only a delegated clinician can assess causality and expectedness. Note that only the events listed in the protocol and shown here are expected of the IMP. If the event you are describing in this form is not one of the ones listed here, then it is an unexpected event. Please also complete section 8 if you need to add further information, and then section 9 to complete details about the PI or delegated individual at your site. Finally, please add details of the person completing the form in section 10 if it is different from the PI or delegated clinician detailed in section 8 of the form. Please send the form to UHBW and the Coral Study Team using the email addresses shown here within 24 hours of you becoming aware of the event. We would prefer an incomplete form rather than a delayed form. If you need to send us more information about the event at a later date, please complete the follow-up form. This form is similar in format to the other form and allows you to supply extra information about the event should it become available. This form is also available on our website. The form to report serious adverse events that are deemed not related to the Coral IMP looks like this. You will need to fill in all available information that you have at this stage. Note that for the primary event, this should be the diagnosis where possible, or main symptom if diagnosis is not known. Please only tick one option. The onset date is the date that the event became serious, e.g. the date they were hospitalised, not the date the event started. Please complete all sections on this page if you have the information. The question, was the event related to the Coral Study capsules, must be completed by the PI or a delegated clinician. There are notes about the classifications of the events to aid your decision making at the end of the form. Once complete, please email the Coral team ASAP. We would prefer an incomplete form rather than a delayed form. If you need to report more information about event later on, please complete the serious event follow-up form, which is shown in the next slide. Please complete all the sections with any additional information you have. On this form, you can add more details about the event, the intensity of the event, the outcome, end date, and if they're withdrawn, and if the causality assessment needs to be updated from the initial reporting of the event. Once this form has been completed, please send it to the Coral team on the email address shown. This form is to be used to report adverse reactions. These are events that are not serious, so they haven't caused the person to be hospitalised, for example, but you think they are possibly, probably, or definitely related to the participant taking the Coral IMP. Please complete information about the participant and details of the person reporting the event. The PI or delegated clinician must be listed here and complete the relatedness assessment. Please then fill out details about the adverse event or events. The table on page 2 should have one row per event. These events should either be from the list at the top of the page, which are expected events for the IMP, or can be other. The final page, which is not shown, contains notes about the classification of the events to aid your decision making. Once you've completed as much as you can on the form, please email it to the Coral team as soon as possible. We would prefer an incomplete form rather than a delayed form. If you hear about an adverse event that is not serious and unlikely to be related or not related to the participant taking the Coral IMP, you do not need to complete any forms or report it to us. However, please document your record of assessment and the action that was taken in the participant's medical records. If you have any queries about which form to use, please contact us so we can help you. As mentioned earlier, you can opt in to offering participants face-to-face appointments for the study, to receive informed consent, or to help participants complete study questionnaires, if you have both staff and room availability. We don't anticipate many participants will request to do this. However, there are additional site payments for each face-to-face appointment available. Receiving informed consent must be carried out according to GCP guidelines. Consent must be voluntary and informed, and participants must have the capacity to consent for themselves. Informed consent is obtained by revisiting the study information provided to ensure that the subject understands the study, its risks, and what participation in the study would involve. This may be assessed by asking the participant to explain what they understand about the study, e.g. the frequency of questionnaires, the intervention, and possible side effects of the pills, and by answering any additional questions that they have. Importantly, site staff must be delegated to complete these tasks on their delegation log before undertaking them. Blank consent forms and questionnaires can be downloaded from the website at www.coral-study.bristol.ac.uk in the GP info section. We anticipate some participants may need an impartial witness or a translator to help understand participant documents and for consenting. This could apply to sites, as we might ask site staff who are not on the delegation log to be an impartial witness. Alternatively, you may need to use a translation service when talking to participants. More details can be found in the study handbook. If there is an emergency or clear clinical need, participants can be unblinded to their study allocation 24 hours a day, 7 days a week via the UHBW pharmacy. The contact details are on the slide. If you hear of a participant wanting to withdraw from the study, please contact the Coral BTC team. Participants can stop taking Coral study medication without withdrawing, so carry on completing the questionnaires, withdraw access to their medical records, or withdraw from the study completely. Finally, if you become aware that a Coral participant has died, please let the Coral study team know as soon as you become aware, using the contact details on the slide. GP site setup involves the following steps before you're given the green light to begin participant recruitment. For training, most study-specific training is done by watching online modules. The first module is this overview, which must be watched by the GP research lead, any clinician who will be running eligibility checks, and anyone who will be interacting with participants face-to-face. The second module is the database searches and screening video, which covers the specifics of checking patient eligibility and LVSD coding. This needs to be watched by all clinicians who will be adding the LVSD coding or completing the eligibility checks. Other site staff who are supporting the study only need to read the Coral Study Handbook. For documentation, the GP research lead must send us a copy of their GCP certificate and a 2-page signed and dated short CV. All staff involved in the study must complete a training and delegation log, so there is one per person, which is maintained by the GP research lead. For agreements, please complete the GP registration form, which we will then use to populate the Model Non-Commercial Agreement, or the MNCA, for you to sign. Please note that the MNCA is the official contract and confirms that you have capability and capacity to take part in this study. Once all the above is in place, your surgery will be given the green light to open. Full details can be found in the site opening and green light process handbook. We will not be providing sites with traditional paper site files. Instead, to be more environmentally friendly and ensure all sites have access to up-to-date documents, a central site file will be held on the study website. This can be found at www.coral-study.bristol.ac.uk and selecting the GP Sites Only tab. The section is password protected and you can enter using the word coenzyme in lowercase. All site file documents will be accessible here, including the protocol, patient information leaflets, as well as the approval documents. Additionally, in the training section, you'll be able to access the appropriate training modules. As a site, you are responsible for keeping the training and delegation logs and signed MNCA stored safely. This is one of the ways you're compliant with GCP. At the end of your involvement in the Coral study, we will need to close your site. Close down will include archiving of any paperwork, adding end dates to the delegation logs, and sending any leftover capsules back to the Coral BTC team if you have received any. We will be in contact with you when it is time to close down your site and to give you more instructions. The following payments are available for the Coral study. The one-off costs include £779 for site setup and £204 for the close-down fee. The per participant cost will be paid to you according to how many participants have been randomised from your practice. These include payments for baseline and 12-month medical notes review and eligibility reconfirmation. If you see participants face-to-face for informed consent or for questionnaire completion, there are additional payments for this. For the full details of the service support costs, please see the relevant RISP or your RDN's website. So what next? If you'll be helping with database searches, adding LVSD codes or eligibility screening, you will also have to watch the video on the database searches and screening. For other GP site staff, i.e. if you're not a GP and you're involved in the Coral study, you must read the study handbook. Any administrators or other site staff who won't be interacting directly with the Coral participants must watch the safety reporting video. All training documents can be found on our website in the For GP Sites section. The password for this section of the website is coenzyme. Now is the time to collate the paperwork for the study, including the PI's GCP certificate and CV, completing the training and delegation logs for any staff members working on the study, and the MNCA, which is the site contract. Blank copies of the training and delegation logs can be found on our website. The code word for the training module is staghorn. You will need to enter this on your training log. Thank you very much for supporting our study and for watching this training module. If you have any questions, please contact us using the study mailbox. You can also call us on 0117 455 6725. Finally, just a reminder that if you would like a remote meeting to go through anything for the Coral study, please let us know and we can arrange this with you.